So maybe you've been told that you have sleep apnea. What does that really mean? Is there only one type of apnea? Are there different types? Actually, there's two primary types of sleep apnea. The first is a neurologic or a brain-based type of apnea called central sleep apnea. Think central nervous system. Then you've got obstructive sleep apnea, which is actually more of an anatomical or structure-based type of apnea. That's the kind that we've been talking about where the back of your throat collapses. You see, in central sleep apnea, the brain-based type, there's actually no effort to breathe by the body. So think about it. It's like a long sigh. Take a deep breath in and breathe out. And just pause. There's no effort by the lungs and diaphragm. There's no airflow coming in or out of the airway. It's just completely flat. And the reason why that's a problem is it will go longer than that 10 seconds we've talked about before, and it will actually cause oxygen drop in your body, which is bad news. The other type of apnea, obstructive sleep apnea, the kind where you're dealing with the obstruction in the back of your throat, again follows that 10-second criteria, but like in the exercises we've done before, you can clearly see that there's body effort, lungs and diaphragm trying to breathe in and out, yet there's no airflow because there's a blockage or an obstruction in the airway, usually in the back of the throat. So those are two very different types of apnea, central and obstructive. The more common one is obstructive sleep apnea. That's associated with snoring, and that's the type of apnea that you're probably commonly hearing of. If you have central sleep apnea, it's important to know that because that's something that only your physician can treat. If you have obstructive sleep apnea and snoring, that's something that your physician as well as your dentist can treat. So it's important to know what type you have and who to talk to about it.